Hello, everybody. Welcome to today's lecture, and we continue covering the central nervous system. So I already covered most of this PowerPoint in my video 1 and video 2. So I'm just gonna start where we left. So let's go ahead and begin. So blood supply to the brain. So we, on this diagram, you can see we have two major arteries that supply brain with oxygenated blood, and it will be vertebral artery. Let me get my pen very quickly. Right, so vertebral artery right there. That's this one, and common carotid artery. Well, common carotid artery actually then bifurcate into internal carotid and external carotid artery. So here's our internal carotid artery right here. So internal carotid artery, internal branches supply the brain, and external branches will supply, skin and muscles of the head and face. They passing to the cranial cavities through the carotid canal. Also, orthostatic reflex is the, what orthostatic reflex is when you stand up from a sitting position very quickly, your blood pressure drops, and you have baroreceptors in your common carotid arteries, and those receptors are responsible for this orthostatic reflex. Vertebral artery enter cranial cavities through the foramen magnum, and then so we have two of them, right and left, and then they fuse together, making a basilar artery over here. So this part of the brain is pons. Now these two arteries, internal carotid and vertebral arteries, that actually four, right, left and right internal carotid, left and right vertebral artery, those became basilar arteries. They form this connection of blood vessels, connection of arteries called circle of Willis. And this allow you to maintain perfusion. So you can see you have a pretty interesting pattern of blood supply to the brain, several arteries. Then we have anastomosis. Anastomosis means when different arteries kind of fuse together that allow continuous blood flow. So if, for example, even if something is wrong with vertebral artery, right, there is a clot over here, you still have this blood going because you have lots of connections between blood vessels. So it's what we call anastomosis. So let's look at some important arteries that we need to know, and they're really kind of easy to remember. So we have vertebral arteries became basilar artery, and we have internal carotid artery, and then we have anterior cerebral arteries, right? So like this one over here, and then this one. So right and left, we have middle cerebral artery and posterior cerebral artery, right? Those are the ones that we need to remember. Now, when your blood receives oxygenated, when your brain receives oxygenated blood and nutrients, those neurons and glial cells, they use this oxygen and nutrients. They metabolize them, or they conduct lots of metabolic processes, metabolic reaction. And as a result of all this metabolic reaction, you produce byproduct and waste product. And this by and waste product need to be removed from your brain. And this is done through the venous circulation, right? So venous carry deoxygenated blood and waste product from metabolic reaction to your lungs, to your kidneys, so you can get rid of them, right? So here we can see venous return. So in your brain, we call, instead of veins and veins, we call them really sinuses. And sinus is a vein. It just sometimes a vein with thinner walls or flat, like flat veins. And we call flat vein sinus in anatomy, right? So we have superior sagittal sinus. So you look at the, it's a side view, right? So it's a sagittal view. So it's, the sinus, so that's anterior part and this is posterior part. So that's our superior sagittal sinus. Then we have inferior sagittal sinus. Then we have transverse sinuses. Then we have, look like S, sigmoid sinus and cavernous sinus right here. Now, all these blood vessels and, many others collect blood to the internal jugular vein, and then internal jugular vein bring it to your subclavian vein, a brachiocephalic vein, and then a superior vena cava and back to the heart, right? So here we just have names for those sinuses that we already look at: superior sagittal, inferior sagittal, cavernous, transverse, and sigmoid that is not mentioned here, and jugular veins. Now your brain is also protected. It's protected by skin and fat and connective tissue and muscles at some area. For example, on superior part of your skull, you do not have muscle, but you have aponeurosis, that is connective tissue. Then it's protected by bone. And then we have fluids and membranes. Now those membranes that protect your brain, and your brain is shown over here like this brown and this white part, and that's your brain. And those membranes that protect your brain called meninges. Right, so it's a series of membranes. So we have three of them. We have dura mater, arachnoid, and pia mater. So they show over here. So you have dura mater, and it has like 2 layers here and over here. Then we have arachnoid right there, and we have pia, and pia covers your brain surface, right? So this is the deepest meninges. So dura mater means tough mother. It's a thick fibrous layer. It covers your entire brain and spinal cord. It attaches to cranium and vertebral cavity. It also surrounds and supports those venous sinuses. So remember, we just mentioned the superior sagittal sinus, right? So it's found within this dura mater, right? So we have, as I said, 2 layers of dura, and between these 2 layers we have our sinuses. So next membrane is arachnoid matter, shown right there, and it's a middle layer. And below arachnoid matter, we have subarachnoid space. Sub means below, right? And so it's below arachnoid. Importance of this subarachnoid space is that cerebrospinal fluid, CSF, is circulating within this space. So if you ask where this cerebrospinal fluid is, it's in subarachnoid space. Now you also can see like a spider shape structure over here, right? Arachnoid trabeculae. Arachnoid means a spider anyway. So this area look like spider web. That's why the meninges is called arachnoid, and you can see those structure trabeculae in subarachnoid space. Another interesting structure over here is arachnoid granulation. So those are arachnoid granulation over here. And those are like little villi or structures that return cerebrospinal fluid back to sinuses, because cerebrospinal fluid is actually produced from blood in capillaries, right? So blood in the capillaries, and we will talk about it in a minute. That plasma from that blood within capillaries is modified by supporting cells, and cerebrospinal fluid is made. Cerebrospinal fluid covers your entire brain and spinal cord, but then, it's constantly produced. That means we need to get rid of it. That's why we call it circulation of cerebrospinal fluid. It's not like you made it one time and you have it forever. So it's circulating. So it's moving from your capillaries to subarachnoid space, and from subarachnoid space to the venous sinuses, right? The deepest membrane is pia mater. That means tender mother. It's continuous layer of cells, and it extends into convolutions. So that's really over here. We have the pia mater that cover your entire brain tissue and spinal cord. Oops. Okay, but now on this diagram, you see ventricular system. Now, what is the ventricular system? So if you look at this diagram here, you can see that inside, deep inside your cerebrum and brain stem, you have chambers, and those chambers we call ventricles. And inside these ventricles, you have cerebrospinal fluid, and cerebrospinal fluid is produced inside those ventricles, right? And they are interconnected. So let's first see what type of ventricles we have. So now the biggest ventricles called lateral ventricles. So we have two of them. We call them lateral ventricles. This ventricle in the middle, it's a third ventricle, right? We don't call it ventricle 1, ventricle 2, I guess, because we don't know which one gonna be 1, which one gonna be 2. I have no idea why we don't call it ventricle 1 and ventricle 2, but we call it right and left lateral ventricles. But because we have two of them, next ventricle is third ventricle. And this one, the most inferior ventricle, is the fourth ventricle. So we have total 4. 2 lateral, third, and the fourth. Now, the lateral is a bigger one, and it has several horns. So in this diagram, they call it frontal horn, occipital horn, and temporal horn. I like this name better because it tells you what lobe those horns are located in. But you might also see this is called anterior, this is called posterior, and this is called inferior, right? So whatever you want to use frontal, occipital, temporal, that's good. Then we have, now so lateral ventricles, they are connected to the third ventricle, right? And then the third ventricle is connected to the fourth ventricle. And this connection called aqueduct, cerebral aqueduct. And then fourth ventricle continues with this structure over here that becomes central canal. And central canal found in your spinal cord, right? So in the fourth ventricle, we also have this lateral recess and some opening foramen over here that we're gonna look at it on our next diagram. So I told you that inside those ventricles, you will find cerebrospinal fluid. So let's make a sense. So here's our lateral ventricles, so shown right here, right? This is our third ventricle over here, and this is the fourth ventricle. Right now, inside those ventricles, you have this structure right here. And right here, it's shown here, and it's shown over here as well. Now, the structure is called choroid plexus. So we have choroid plexuses in all three ventricles, right? In the lateral, in a third, and in the fourth ventricle. Now, this choroid plexus, this is that network of capillaries that I just mentioned. So those are capillaries. Inside the capillaries, you have blood. The blood squeezed out from the capillaries, and this fluid squeezed from these capillaries becomes cerebrospinal fluid, right? So you produce cerebrospinal fluid within all four ventricles, and then you see that's why they interconnected. And then over here in the fourth ventricle, we have lateral aperture. That's openings that I told you about, and medial aperture. So we have two lateral apertures and one medial. And from this opening, cerebrospinal fluid enters subarachnoid space, you see. And now subarachnoid space, it really, and cerebrospinal fluid covered your whole brain. And then it's also moves in a central canal, right? And you have subarachnoid space as well in a spinal cord, right? So that's a circulation of cerebrospinal fluid. And then this is our granulation, right? And this is where cerebrospinal fluid returns back to your blood. And this show here superior sagittal sinus. So apertures, median, and pair of lateral connect to subarachnoid space and important in cerebrospinal fluid circulation. Okay, so now let's see what we have right here. So pretty much summary of what we just said. Choroid plexuses produce and secrete cerebrospinal fluid. Cerebrospinal fluid produced from components in blood. Flow is tied to cardiovascular circulation. Now lateral ventricle, then third ventricle, then fourth ventricle, so all these connections, and spinal cord. About 500 milliliters produced daily. That's why we need to, circulate it. So we need to return it back to your sinuses, to veins of your brain. Cerebrospinal fluid cushion your brain and collect metabolic waste. And here we have location in the central nervous system and blood vessel structure. So lateral ventricles located in cerebellum, and they have choroid plexus. Third ventricle located in diencephalon, and it also has choroid plexus. Then we have cerebral aqueduct that connect third and fourth ventricle, and cerebral aqueduct in the midbrain. We don't have any blood vessels over there. Fourth ventricle between pons, upper medulla, and cerebellum also has choroid plexus. Central canal found in the spinal cord, no blood vessels. Subarachnoid space, external to entire CNS. So that means this kind of on the top, right? And external means on the surface. So we have pia mater, then we have subarachnoid space, brain and spinal cord. And we have arachnoid granulations. Those are our blood vessels. Now they return cerebrospinal fluid back to venous circulation, right? Okay. And the last topic we want to cover in central nervous system is homeostatic imbalances of brain and spinal cord. Right, so over here you can see traumatic brain injuries, concussion, and contusion. So concussion is temporary alteration in function. All right, so when you have some maybe not that strong impact on the brain, and you know, you will have some obviously effects of this impact, like headache, like maybe vertigo. You might also feel nauseous, and might have you know, some problem with concentration and so on. But this is temporary. So temporary alteration in function. Contusion is permanent damage. Right, you can see, for example, this we have some hematoma over here, so the blood vessels were ruptured, and you see blood enters the cranial cavity. Right, so that might be, again, it depends. People recover from contusion, but it might have a long-lasting effect. Another homeostatic imbalances over here are hemorrhage and edema. Now, a hemorrhage, it can be subdural, subarachnoid, depends where exactly the blood vessel was damaged. So, for example, we have a dura mater over here, and this is under in dura mater, so it will be subdural hemorrhage. You see blood vessels is damaged over here. In this example, the hemorrhage is in subarachnoid space, because that's, so you see that's the yellow part, that's your subdural space, and this is your subarachnoid. Cerebral edema is a swelling of the brain associated with traumatic head injury. So, for example, cerebral edema can happen when you have contusion. Right, so over here you have cerebral edema and hemorrhage as well. Cerebrovascular accident, this is what we call stroke or CVA. So CVA, cerebrovascular accident or stroke. This is when we have, you know, damaged. It can be, so let's look over here. It can be ischemic stroke or it can be hemorrhagic stroke. So in the first example, you have the blood circulation is blocked and brain tissue dies. So if you have a blood clot within a blood vessel, that means that area of the brain that is supplied by these blood vessels doesn't receive oxygen and it starts dying. So cells are dying. And this is what our ischemic stroke. So ischemic means not enough oxygen, deficiency of oxygen. So that's a blockage of a cerebral artery by a blood clot. Now, in this example, we have hemorrhagic stroke when we have rupture of blood vessels. And now, so over here, so you have, you know, blood leaking out, and this causes edema, inflammation, and, you know, blood cells gonna die as well. Right, so here we have a blockage, and here we have a rupture. That's hemorrhagic means bleeding. Stroke that is a result of internal bleeding within cranial cavity. So typically strokes lead to sensory and speech deficits. That's, I think it should be speech. We also have what it's called transient ischemic attack, or TIA. That's a temporary episodes of reversible cerebral ischemia. So we call this one mini stroke or TIA. And please remember this abbreviation because, you know, if you have a, you know, patient and you suspect stroke, you might ask a patient or relative, did they have TIA before? TIAs, that is a small stroke that usually indicator that something is wrong and the big stroke might be coming up. Now, the approved treatment for stroke is TPA, or tissue plasminogen activator. And this is what gonna, this one is used when you have ischemic stroke, because this is more common. And what it does, if we have, you know, if you have a blood clot that is formed, so here's a blood clot, for example, you're just gonna dissolve this blood clot using TPA. Okay. Degenerative brain disorders. Degenerative means, you know, the neurons are dying. So neurons are dying. So we have Alzheimer's disease. Everybody heard about this disease, progressive degenerative disease of the brain that results in dementia or memory loss. Parkinson's disease, degeneration of a dopamine releasing neurons in substantia nigra, and this is in the midbrain. And Huntington disease is a fatal hereditary disorder caused by accumulation of the protein huntingtin and leads to degeneration of the basal nuclei and cerebral cortex. And basal nuclei is deep to cerebral cortex. So in all these three examples, you have neurons that are dying. So for example, over here, you can see in the Parkinson disease, so this is healthy neuron, it releases dopamine, and dopamine, you know, activates other neurons to allow your brain to function properly. Now, when you have deficiency of dopamine, because this neuron is dying, then you have some movement disorders, right? Because you do not stimulate appropriately dopamine receptors. Okay, so next one, we have some trauma of spinal cord now, right? So we previously covered diseases that affect brain, now spinal cord trauma. We have paresthesia and paralysis. Paresthesia is a sensory loss, and paralysis is loss of a motor function. So here's the paresthesia, so tingling, numbness, crawling itch, can cause pain, can cause skin sensitivity, right? This is where we have sensory neuron, and you know, sensory neuron either damaged, or you know, and the information does not reach a spinal cord, or the spinal cord cannot send sensory information to your brain, right? Now, so if you lose sensory loss is paresthesia, motor function, loss of motor function is paralysis. Okay, so so here's two types of paralysis will be described in this chapter. Flaccid paralysis, it's severe damage of the ventral root or ventral horn cells. Now, both ventral root, so ventral root is, so if you have spinal cord, right, then you have two roots that branch or originate, not branch, originate from spinal cord, ventral or anterior and dorsal or posterior. Now this ventral root, both dorsal, ventral and dorsal, they will fuse together to make spinal nerve, right? So is a damage of ventral root or ventral horn is within the spinal cord. It's a gray matter of spinal cord. So to understand what ventral root and ventral horn is, you need to watch first and second video that covers this chapter. You know, I showed it to you and I described you what it is. But when we have damage of ventral root or ventral horn, then impulses do not reach muscles. There is no voluntary or involuntary control of muscle. So your muscles are flaccid, they're not contracted, they don't have muscle tone, and it will lead to muscle atrophy. Right, so that's a flaccid paralysis, and you see where damage happened. It damage happened on the level of the spinal cord, and specifically ventral root or ventral horn. So this is a low motor neuron. is damaged, low motor neuron. Now, we have spastic paralysis, and this is a damage of upper motor neuron of the primary motor, or, upper motor neurons, of the primary motor cortex, sorry. And in this situation, spinal neurons remain intact and muscles are stimulated by reflex activity. So muscles are stimulated, sometimes they even overstimulated. So you see they became very spastic, very tough, contracted. Muscle tone is increased. Hypertone, you see over here. And they activated by reflex, but not by your will, because you can't control your skeletal muscles, right? The person with a spastic paralysis, muscles are contracted, but they contracted by reflex, no voluntary control of muscles. So we have flaccid and spastic paralysis. Now, another spinal cord trauma is transection. Now, please keep in mind when we have transection of spinal cord, and it's very important. And I believe I always put this question on the exam. You don't only lose motor function, you lose both motor and sensory function. So motor and sensory loss in region inferior to the cut. Because honestly, all students know that if you damage your spinal cord, you might have paralysis. And paralysis is what? Paralysis is when you lose motor function. It's right here, paralysis. But students completely forgot that if you have transection of the spinal cord, you also have paresthesia. And that's important because that shows me that you understand that your spinal cord carries not only motor information, but sensory information as well. So please do not forget that when we have transection, we lose both motor and sensory function in region inferior to the cut. Now we have paraplegia and quadriplegia. Well, paraplegia, the word itself means only two extremities are affected. So over here we have paraplegia. Over here we have paraplegia. So only legs are affected. Para means two. Quadriplegia, then when you have arms and legs are affected. And again, both paralysis and paresthesia. That's paraplegia transection between T1 and L1, right? So you will see right here. So it's in the thoracic region. I'm sorry. Yeah, paraplegia between T1 and L1. So that's in the thoracic region. Quadriplegia when you have in the cervical region. So if you have damage in the cervical region, then both your arms and legs, and of course the higher the damage is, transection means you go right across, right? Transection. The higher the damage, the more body, the more parts of your body are affected, right? But that we want to remember paraplegia, right? There's two extremities, legs, and quadriplegia, four. And quadriplegia is in the cervical region. Polymyolitis is distortion of the ventral horn motor neuron by poliovirus. So that's a viral disease. And because we have destruction, did I say destruction? Destruction of a ventral horn. So when we have damage of ventral horn, remember there's going to be our flaccid paralysis. Just in this situation, we have a virus that affects the ventral horn, and flaccid paralysis leads to muscle atrophy. This may occur due to the paralysis of respiratory muscles or cardiac arrest. Oops. Okay. And ALS, also called Lou Gehrig disease. It's amyotrophic lateral sclerosis, involves progressive destruction of ventral horn motor neurons and fibers of the pyramidal tract. So, so this pretty much may affect, if it's affect ventral horn, that's that can be low neuron, and fibers of the pyramidal tract, that's an upper neuron. And Stephen Hopkins is a famous gentleman who died from ALS. He actually lived way beyond his prognosis. So he's one of few people who lived a longer life. Usually people die within several years. So symptoms is loss of the ability to speak, swallow, breathe, and you losing control over your skeletal muscles because your neurons just dies. Again, degenerate, die. Okay, and that's it for this lecture. So we covered the central nervous system, and it took me 3 videos to cover anatomy of the CNS. So please make sure you watch all 3 videos. And next video that I record will be about the peripheral nervous system. So thank you for watching, and I hope it was helpful.